this is Megha. I'm from Burma, Myanmar. So I've come to CK Birla Hospital to get my weight loss surgery done with Dr. Saggu. So I've been overweight all my life. I'm currently weighing 135 kgs. So I have a lot of other issues like I'm pre-diabetic, I have PCOD, I have shortness of breath, I cannot do much exercise. So I get easily tired from day-to-day activities. So I researched online for the best ways to help me lose weight. I've done many other things before like exercise, yoga, and then gastric balloon, endoscopic gastric balloon, but everything turned out to be a failure. And then I had a video consultation with Dr. Saggu from CK Birla Hospital, and then he explained to me about this procedure, mini gastric bypass, and then I was very nicely explained the whole procedure, and he kind of convinced me that this is the best procedure and it will help me lose most of my weight. And so now I'm pretty much convinced. So now I'm ready for my surgery, hoping everything will turn out well and I'll recover very soon, as convinced by Dr. Saggu.
Hi Megha, how are you?
I'm good.
You're looking very good.
Thank you.
So, when was your surgery done?
Yesterday.
Okay. And what surgery it was?
Mini gastric bypass surgery.
Okay, it was a weight loss surgery.
Yes.
And what is your experience about surgery?
So, very good experience, not much pain. I mean, like, you can see me now. Just yesterday I had the surgery and today I'm all good walking around, climbing up and down.
Okay. So, when did you get your sips of water? When you started your liquids?
Just the same evening yesterday.
Okay, yesterday you started your liquids and
yes.
Today you are climbing up and down?
Yes.
Oh, good. And you are walking also?
Yes, I'm walking.
And how are you feeling, your energy?
Yes, it's all good, like nothing happened.
Okay. And what about the pain?
Very minimal, very minimal.
Okay.
Just a little slight uncomfortable feeling, that's it.
Yeah, because most of the people, they are scared of the pain, that this is a very painful surgery. Mm-hmm. Is that true?
No, not true at all.
Okay. And how was the surgery done? You know about the surgery? Was it open surgery,
no,
big cut?
Small incisions.
Okay.
I noticed 4 small incisions on my tummy. Yeah.
So Megha, have you thought of that this surgery would be so comfortable for you?
No, I didn't, because before also I had another type of weight loss surgery done, but it was completely different feeling than that.
Okay, but this was comfortable?
Yes. That one was non-invasive. I did it through endoscopic. Okay. But the feeling is completely different.
Because the most of the people, they are scared of that this surgery would be big surgery, number one. Mm-hmm. And number 2 is it would be a very, very painful surgery. Mm-hmm. Is it true?
No, not true at all.
Okay, and today you are getting discharged also?
Yes.
Hi guys, today we are with Miss Megha from Myanmar, and I would say she is a true fighter because she took a very, very good decision for the weight loss and for all the problems which she was facing. Let's have a discussion with her and ask her the truth. You're welcome, Megha. How are you?
Thank you, I'm good.
So first of all, many congratulations. You took a very good decision, and I think now you have a permanent solution for your problems.
Thank you, sir. I do think now this is the permanent solution for my weight loss issue. Yeah,
Megha, how difficult was this to take a decision, and what is your experience about because you got surgery done, weight loss surgery done, I think yesterday? Yes. And today you got discharged?
Yes. So it definitely was a very difficult decision to make because first of all, once you think of surgery, you always think of the big incisions and then the scars, so it was making me nervous. But then after my consultation with Dr. Saggu, everything went fine. He made sure I felt comfortable, he listened to me, he listened to all my problems, and he made sure I understood the whole procedure very nicely. So yes, once I understood the procedure, it was an easy decision to make.
And what is your experience with the surgery? It's been not even 24 hours of your surgery.
Yes, so the surgery went very well. I was very well taken care of, and now as you can see me in less than 24 hours, I'm like a healthy person moving around, climbing stairs again. So it's just like a very basic procedure.
And what is your experience about the hospital and your surgeon?
And about the hospital and the surgeon, the hospital itself is very neat and tidy, just like how I like it. I'm very choosy in that case, so I think I made the best decision because it makes me heal faster by itself only. So, and the staffs over here are very nice, very kind. All the services are very, very good. All the staffs are very well trained. So yeah, this hospital is the best decision that I made for this procedure. And of course for the surgeon, I know that I was in the best hand.
Yeah, thank you so much. And do you know that now you got your surgery done and the rest of your follow-up, how would be your follow-up?
Yes, as advised by you, so I'll be coming for a follow-up, and then until then I'll be taking my normal clear liquid diets, and then move up to protein, and then step by step.
Yes.
Since you're keeping in touch with me on WhatsApp also, then maybe we can discuss, and I'll always be here for my follow-up.
Yeah, here I would like to mention that surgery is a 50% of your success, and rest of the 50% is your follow-up.
Yes.
So how you do your follow-up? So many things are there. I mean, the important thing is your protein, how you take your proteins, and then your supplements, because all the vitamins you have to take. Being a non-vegetarian, I think you will not be having any much problem, but even then you have to take proteins and your supplements, and then your exercises.
Yes.
Then you have to start your exercises, because you are going to lose fat but not the skin. So to tighten the skin, you have to do a lot of exercises, and also you need to take body massages at least twice a week. And of course, what would be your message to my audience or viewers?
So my message to all the viewers would be that if you're thinking to get weight loss surgery, then don't take much time, just make the decision, just come and consult with Dr. Saggu, and I can promise you you're in safe hands. Just look at me. Yesterday was my surgery, and today I'm sitting here fit and fine, talking to all the viewers today.
Yeah, that's sure. And here I would like to mention about your surgery. Mega, you got the mini gastric bypass done, and my dear friends, mini gastric bypass is the latest technique of gastric bypasses, where we do two things. Number one, we reduce the capacity of the stomach, and number two is we reduce the absorption. So by reducing the capacity of the stomach, we make sure that you should take less calories, and by decreasing the absorption, we ensure that whatever the extra you take, that should not be absorbed, so that it should be passed through your motion, whatever extra you have taken. So by these two things, your portion size, your calorie also goes down, and by decreasing the absorption, we make sure that at least your some hormones, because all these things are hormone based. When there is a hormone imbalance, then you have lot of problems, like you have a PCOD.
Yes.
So by decreasing the absorption, there is a hormone that is the GLP-1 that also goes up. When GLP-1 is on the higher side, it will reduce you have insulin resistance also.
Yes.
So that will also be taken care of. After that, your insulin resistance will go, and you will be having less chances of developing diabetes in your future. Second thing, you mentioned that you had a PCOD.
Yes.
So PCOD is a big problem for the young girls, I would say. This is because of adipose tissue. If you have more adipose tissue, then your estrogen becomes resistance. There is a more estrogen that will the cause for the PCOD. Once you are going to reduce your adipose tissue, your hormone will be more responsive, and it will become more sensitive. Then your problem of PCOD will also go. So these are the few things, because obesity causes all these problems, and you can have solution for all problems by this bariatric surgery, this mini gastric bypass. Congratulations, and many thank you.
Thank you. Thank you.